go. So dry the area, and we're gonna get the patient numb. Good. Just a little pinch here, Vince.
Okay, here we go. Oh.
And then just a little water and suction. All right. Think it's pretty numb, Doc? Take a look.
Take a quick look. Yeah, we're gonna repair that. Good. Okay.
So everything with the composite is the same going up to removing the decay.
Yes.
All right, here we go.
There we go.
So you want to make sure that your suction is whatever direction that her burr is facing. So if she goes here, I want my suction this direction. If she turns and works on the incisal edge, I'm going to go here. And then when she stops, air, water, air.
Okay, I'm gonna check for decay.
Done with the spoon?
Yes. Okay, let's get ready to put a filling in.
And then you want to make sure you go down here and make sure that you get any saliva or anything that's down there. All right, so we're going to place the cotton roll right up in the top here because we're working on tooth number 8. There we go. And now our matrix system is a mylar strip, so it's a clear strip. Doctor's going to put it in. Same thing, it's going to have a wedge. Just like that. I've got kind of a long mylar strip, but that's okay. All right, so now composite, we're gonna have to etch the tooth first. So when you hand the etch, I want you to hand it with a 2x2 because the doctor's gonna dispense out a little bit to make sure there's no bubbles or anything in the etch. Gonna etch the tooth, and the etch is gonna stay on for about 15 to 20 seconds. And the doctor is actually going to rinse. So before the doctor rinses, you're gonna suction off the etch and then roll off so she can rinse it.
For 15 to 20 seconds.
Once she does air, you can get any water that's down there and then come on out. Now we're going to have to put primer on the tooth. So micro brush. And then I'm going to block where I don't want my doctor to go because we're going to use 1 and 3 in this. 1 and 3. So I'm blocking 2 and 3 so she doesn't use that part. And then she's going to blow some air. And we want our suction when she blows air. Good. And now we're going to cure.
Oh, we're gonna put some Bond on it.
Bond. I'm sorry. There we go. So now I'm going to make her go in 3.
With a different colored.
Yes, different colored micro brush.
There we go.
She's going to blow air. I'm in with my suction. Then she's going to cure.
Do you really want me to do it?
Sure. Might not be charged, that's okay. So we're gonna cure, beep. Take that back, and then now we're gonna put flowable material on. And you're gonna hand it with the 2x2. She's gonna dispense some out. And we're gonna cure. Beep. I'm gonna take that, I'm gonna hand her the packable, which is thicker. She's gonna place some packable. And then I'm using the plastic instrument. So I'm gonna take the gun, give her the plastic instrument. And then I'm gonna come back with a little bit of the bonding. So in case she needs it to keep her, instrument. So it slides along there well. So it doesn't stick to the composite. So this is where she's kind of shaping it. See that? And now we're gonna cure. Okay. Curing.
I'm gonna go down here too.
Beep. So it's going from the facial and the lingual to cure it. Beep. I'm gonna take that. Now she's gonna remove the matrix system. And then we would floss, so we're gonna simulate floss. I'm gonna hand it to her. She's gonna floss in that area to make sure everything's good. Good, all right. And now we need to check the occlusion. So the difference between composite and amalgam is, the amalgam is pliable, so we can adjust it if there's anything going on with it. But as far as the composite, once we cure it, it's completely set up. So she's gonna have to contour the tooth with the handpiece. So again, just use your suction to follow her burr. So if she goes inside, oh. And sometimes you have to drop down and get anything built up in the back and come right back up.
Check occlusion again?
So she's going to check the occlusion.
Oh, looks good.
Looks good. Okay, so we'll polish that off. So now everything is good, so we're just going to polish up the surface, so kind of smooth it up. So here you need to have your suction down, and this is the kind of hard part. You have to drip some water because the slow speed doesn't have any water coming out. But we want to keep the tooth kind of wet. I don't know if you can see me dripping right there. Just little drops, just like that. Okay. Good. Vince, you want to feel it with your tongue there? See how it feels? Feels good? All right. So we're all done. So now the assistant is going to rinse the patient and remove isolation. So I'm going to have Vince turn towards me. I'm going to go ahead and do my rinse. As I'm coming around, I'm just going to wet that cotton roll, make sure it's really wet. Come out, and then I'm just going to grab the cotton roll. All right, Vince, you're all set. Have a great afternoon.
Thank you.